Good afternoon, everyone. I'm Rahul Janardhanan, and I'm the product development engineer at AesculaTech. Today, I'm here to talk to you about Humidify, our groundbreaking treatment for dry eye disease, and why I think it's the next best thing in the space. So I'm sure most people in this room are familiar with what dry eye is, but for the fortunate few that aren't, dry eye is when your eyes don't produce enough tears, the feeling of sandpaper in your eye. In the US, around 12 million patients suffer from moderate to severe forms of dry eye, and they are treated with second-line therapies that go beyond just over-the-counter treatments. Here, we're talking about prescription immunomodulators, steroids, punctal plugs, warm compresses. Unfortunately, these second-line treatments have several shortfalls, ranging from high costs, poor patient compliance, delayed onset, short-term relief. And this sentiment is echoed by the KOLs that we've spoken to. That's what you see in the quotes on the right here. And what this tells us is that there's room for something more in the space. And this is where Humidify comes in, to solve these problems. How does it do that? Well, using a custom, non-degradable, smart material that we've designed. What's really cool about this material is that at room temperature, it exists as a liquid. But the moment it hits body temperature, it transforms into a solid. You take it back to room temperature, it transforms back into a liquid. That's what we've created to treat dry eye. We preload this material into our proprietary microvolume auto-injector, and with the press of a button, it dispenses a small amount of this gel into the tear duct, where it goes in, solidifies into a plug, occludes the tear duct, and improves ocular moisture retention. So the benefits here are evident. You don't have to worry about sizing, extrusion, or foreign body sensation. It's a truly one-size-fits-all solution that form-fits to each patient. Additionally, the same phase transition behavior also aids removal. All you gotta do is flush room temperature saline through the tear duct, and it's gonna retransition back into that gel-like state and just exit the system. It's that simple. Now, we've already tested Humidify in a range of settings, including a first-in-human study. On the left, you can see one of the quotes from our PI in the study that says, "It's the easiest plug he's ever used." And now let's watch him do it. Our results from our first-in-human study. So it's consisted of 22 patients with 4 visits over 3 months. And we looked at several different efficacy criteria, including both signs and symptoms. When we looked at the signs, as measured using the corneal fluorescein staining scale, what we saw was a remarkable improvement in the ocular surface health. And as you can see, those improvements were seen in as little as 2 weeks, and they were sustained over the 3-month period. When we looked at the symptoms, as measured using the OSDI symptom survey results, we saw a similar trend, with significant improvements in the ocular, vision-related, and environmental symptoms. When you take these results together, what you see is patients go from a severe state of dry eye to moderate in a span of 2 weeks to mild and normal within 3 months. And this really does highlight the profound impact our interventions had on these patients. In addition, we also looked at patient-reported metrics. From their own feedback, the procedure was comfortable, both insertion and removal, and they were highly satisfied. How satisfied? Well, each and every patient reported that the plug was comfortable, no foreign body sensation. Their symptoms improved, and they had improved quality of life. Now, if that's not a good treatment for dry eye, I don't know what is. And physicians agree. We surveyed over 150 doctors, including both ophthalmologists and optometrists, and they agreed that they would use Humidify for patients that would not have received traditional punctal plugs. So what this tells us is that Humidify takes that next step and acts as a true tool in the physician's toolbox. How does it do that? Well, it simplifies inventory. There's no need to stock punctal plugs of several different sizes. It saves time. It's a super efficient 3-minute procedure. and it's incredibly comfortable for the patients. And if that's not enough, here's another reason to use it. Humidify is reimbursed. We've confirmed that the punctal plug procedure code in Medicare applies to Humidify, and what this means is that assuming an $80 cost for 2 Humidify devices for bilateral treatment, we are looking at $141 kickback in revenue to the practice. Now, there are very few procedures that you can do out there as a physician that gives your practice such high revenues for what is essentially just a 3-minute procedure. Now, so far, I've only been talking about Humidify in the context of dry eye, but in our surveys, we also asked doctors about applications beyond dry eye where Humidify could be a great fit, and their answers did not disappoint. We heard about applications like pre-surgical treatment, screen-related discomfort, contact lens discomfort. These are all categories where Humidify could make a huge difference, and there's enormous potential to use this technology to treat a much larger patient pool. So, to quickly recap, why do patients and physicians love Humidify? Patients benefit from a quick, comfortable procedure that provides rapid and sustained improvement in their symptoms. Clinics benefit from a quick 3-minute procedure that minimizes inventory and ensures reliable reimbursement. What this translates to is that when we perform some conservative financial modeling for just dry eye, we're looking at $150 million in revenue by year 5. So there's significant near-term market opportunity here. So when can we expect Humidify to hit the market? Well, we've already completed extensive legwork in the development of this technology, and we have a clear path forward. Our next steps include submitting an IDE application by Q1 of next year, followed by a US pivotal study with the goal of obtaining 510(k) clearance by the end of next year. So if you're as excited about this technology as we are and would like to explore the idea of adding Humidify to your portfolio, please reach out. Thank you, and it's been an honor.